Bionics Medical Technologies, improving patient care since 1984, with innovative solutions designed by medical professionals for medical professionals. The OtoClear ear irrigation tip is designed to safely and gently wash away cerumen that is too close to the eardrum or too hard and impacted to be removed with a curette. Unlike traditional single-stream ear irrigation, which can be painful and risks damaging the eardrum, the OtoClear ear irrigation tip with gentle touch design is manufactured from a soft, flexible material and uses 3 streams of water directed at a 30-degree angle away from the tympanic membrane to get behind the obstruction and gently wash it away. The same tip can be used for patients of all ages and features a flared design to prevent it from being inserted too far into the ear canal. Large exit portals in the OtoClear tip prevent pressure buildup and reduce messy backsplash, allowing water to drain into the Bionics ear basin. Because of OtoClear's Lure Lock fitting, tips easily attach to the spray wash bottle. For lower use facilities and patients sensitive to the noise or pulsation of an automated device, the manual OtoClear spray wash kit produces a larger volume per spray than syringes and other manual devices, and includes a temperature gauge to ensure a safe irrigation temperature. The spray wash kit's efficient design allows for a simple 2-handed procedure. Do not attempt ear irrigation if the patient has tympanostomy tubes or has a known or suspected eardrum perforation. The presence of infection, otitis externa or otitis media, is a relative contraindication, and the risks and benefits of irrigation should be considered before treatment.